This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com. Here's your SOM News Update for November 2025. I'm Steve Randall. Professor Neil Greenberg says that since stepping into his role as president of SOM, life has been, in his words, satisfyingly busy. He's been pushing forward on his central aim, improving access to occupational health. To do that, he's met with the Chief Medical Officer, representatives from the Department for Work and Pensions, and contributed to SOM's response to the Mayfield Review. Working alongside partner organisations, including the Faculty of Occupational Medicine, the National School and the Council for Work and Health, he's helped develop a proposal for universal access to work and health advice. That proposal has now gone to the CMO, and early signs suggest that both the CMO and the DWP are supportive. Neil also highlighted that SOM has brought on a new PR and communications agency to boost the visibility of occupational health. And in the spirit of collaboration, he travelled to Dublin for the Irish SOM presidential dinner, reinforcing his belief that SOM is, as he put it, stronger when it works collectively. Neil emphasised that while SOM's central team does an excellent job supporting the organisation's work, the real strength lies in its members. He's encouraged everyone to stay engaged, join special interest and regional groups, and keep that sense of being better together. And finally, Neil made it clear that questions, challenges, and difficult perspectives are all welcome, and invited members to get in touch anytime. The government has launched a major consultation to shape a new 10-year NHS workforce plan for England. It's asking clinicians, organisations and experts to share evidence on what kind of workforce the NHS will need for the future, what roles, what skills and how staff should be deployed to deliver better care. The consultation focuses on 4 big themes. First, how the NHS can shift care from hospitals into communities, move from analogue to digital practice and prioritise prevention over treatment. Second, what modelling assumptions should guide workforce planning as AI, genomics and an ageing population transform healthcare. Third, how digital innovation, improved training and stronger community partnerships can boost productivity without asking staff to work harder. And finally, what good culture and leadership look like, how to support staff, embed strong values and improve retention, well-being and patient outcomes. SOM will be responding, so get in touch if you have comments. The SOM and FOM conference will take place in Nottingham next year. Save the date, 15th to 17th of June 2026. Bookings will open at the end of January, but the call for abstracts is open now. The link's in the show notes. With much discussion ongoing following the Mayfield Review, we've been looking back at an influential piece of research from 2006. Is work good for your health and well-being? Report co-author Kim Burton and OH nurse specialist Janet O'Neill joined me for a discussion on what's happened in the almost 20 years since that report to discuss what has and hasn't changed. The full episode will be out later this week, but here's a little sneak preview.
Workplace health should be looked at internally first and have a look at what's happening internally and what could be put in place before going out to anybody else. But I suppose it's like any service. It's doing your homework on what's right for your organization. If you've got a lot of risks in your organization, then you may very well be looking at occupational health because we want it to be preventative, but ideally, and I think this is the Charlie Mayfield report is really focused on organizations looking internally first and seeing what's right for them, and then looking out and seeing who are the experts that can support them.
Yeah, you've just picked up on something that's really important, Janet. We've been talking about maintaining workability, but actually there's something also about the content of the job itself. It's good jobs that are good for people. Way back, which is what we said back in 2006, it's not just work is good for us, it's actually good work.
Despite the growth in workplace mental health issues in recent years and the cost that this has for employers, little is known about the mechanisms by which poor employee mental health impacts on productivity or about the effectiveness of the various mental health and well-being practices used in workplaces. A new study addresses these vital research gaps. A key focus is on identifying the actions employers can take that can help reduce the personal, business and wider economic costs of mental ill health in the workplace. The study involved longitudinal research carried out between 2020 and 2025 and consisting of employer surveys, in-depth interviews with managers, an employee survey, and case study research. It was funded by the Economic and Social Research Council, building on initial research funded by the Midlands Engine. The link is in the show notes. The Lane Lecture 2025 was on the artificial stone silicosis epidemic with Professor Malcolm Sim. The link for the lecture is in the show notes, but Som also recently addressed artificial stone silicosis on an insightful mini CPD episode with Joe Feary. In case you haven't listened yet, here's a quick taste.
With artificial stone silicosis, it's coming on much more rapidly. So it can come on after, on average, around 10 years of exposure, but some of my patients have got it after only a couple of years of exposure. And therefore, it's affecting a much younger workforce. So many patients are in their 20s and 30s. Because of the nature of the workshops that many are working in, a high proportion of them are migrant workers, and so may not have access to occupational health in the same way, just by nature of the industries in which they're working, the workshops in which they're working.
Som members get all the news first in the e-news email, and remember to catch up with our other podcast episodes in the same place you're listening to this one. They include Special Interest Group, Occupational Therapist and Mini CPD series. And until next time, thanks for listening to the Som News Update. This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of Som members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com.